Today I'm gonna talk about the tuberculosis infections. Firstly, let us understand what is tuberculosis. Tuberculosis, also known as TB, it is a disease that caused by the bacteria called Mycobacterium tuberculosis. These bacteria usually attack the lungs, but they can also damage other parts of the body. TB spread through the air is the airway transmissions. When a person with a TB in the lungs, it can be transmitted through coughing, sneezing, or talk. This is the patient's information that I get for my case study. This patient is the 30 years old Chinese male. Below is the physician's identifications on the patients. The temperature, body temperature is 38 degrees Celsius, the heart rate is 110 per minute, respiratory rate was 20 breaths per minute, the BP was 130 per 76. These patients also have the history of intravascular drug abuse and hepatitis B. In this laboratory findings, the biochemical test, in the biochemical test, the sodium was 133, potassium was 4.1, chloride is 96, and creatinine was 1.8. Based on the identifications of the biochemistry test, all the biochemistry tests was within the normal range. Let's look about the hematology test. The platelets was 149, just above the normal range a bit, and the white cell count was 9.48, also within the normal range. The hemoglobin was 11.4, still can be considered normal for these patients. And the doctor also requests for the HIV test. The HIV test show negative reactions, which means that the patients have not infected by HIV. And in the microbiology, the blood culture, there is no growth after 5 days. There is no blood infections for the patients. The sputum has performed the gram stents. It has observed 4 plus of squamous epithelial cell, 1 plus of segmented neutrophil, and no organism since, which means that there is no bacteria observed in the sputum. And in the AFB, also no organism. In sputum cultures, there is no growth after 48 hours. This shows that there is no organism since in the blood and sputum. In the radiotherapy, doctor has sent the patients for the radiology to check for the X-ray. In the chest X-ray, it showed the infiltrate in the middle of the left lungs with the diameter of 1.7 cm with signs of cavitations. Based on the diagnosis and the laboratory findings, the doctor have identified the patients have infiltrative TB of the left lung with cavitations without MTB seedings. This is the disease that has been identified by the doctors. Based on the discussions, we can know that based on the radiology diagnosis, it showed the infiltrate middle of the lung with the diameter of 1.7 cm with sign of cavitations. This shows that there is a damage on the lungs. Tuberculosis infections usually will affect the lung first. Majority affections of the organs was lung. So the tuberculosis infection was suspected by the doctors. And no organism was observed in the sputum. They maybe have the wrong collections of the sputums, or the tuberculosis infections was only within the lungs, have not infected until the sputum yet. So the sputum cannot identify or observe any organism inside it. In the conclusions, there is almost about 90 to 95% of the patients have suffering TB infections will not show any symptom in the early stage. The bacteria only can remain inactive for many years, and the chance of developing active TB diminishes over time. Okay, thank you.